Dyslexia, it's a very complex area. And I don't know how he's going to complete the overall review of the whole thing in 45 minutes. I think when you discuss about dyslexia, I think there are at least 3 dimensions. One is about the internal circuits neurologically. There are lots of studies recently about MRI, about circuits, about fast reading, slow reading, and all those things. About lots of physical changes in the dyslexic children. That is one dimension. Second dimension is probably something about the language, the linguistic structure of grammar in the languages, particularly the Greco-Roman versus Dravidian versus Japanese Chinese. There are different dimensions about the grammar and the expressivity of the language. And third is, of course, the social. Say, for example, how far the education has really gone into the child. We have one teacher's schools where nothing is really happening about education. Suppose we compare this child with the child who is already doing everything in the matriculation school. We are bound to come to the conclusion this child is relatively less learned. He's got probably a learning disorder. And most of the researches in dyslexia in India have been done by people from education side, particularly in CRT, Mysore group, particularly Dr. Rama and other people. And all of them have got only a list of readings, materials, based on which they diagnose dyslexia. And let us basically remember, diagnosis of dyslexia is one of the very important things, should be done only by the clinician and nobody else. Maybe a pediatrician, maybe a neurologist, but essentially a psychiatrist, and by nobody else. I have seen at least 2 or 3 PhD theses where children have been diagnosed with dyslexia by the author himself. And the veracity of the research. Given the background like this, Radhakanth has got a tough job to go about. I will not stand between. Let him start.
Hello, Chuck. Good morning, dear chairpersons, audience. After a very exhausting discussion about criminality and all, you come to innocence. Dyslexia is about the innocent children. For no fault of theirs, they have developed a disorder. You call it a disorder. Next slide, please. How do we understand? Oh, shall I do it myself? Okay. Yeah, that's this is better. Now we have to ask ourselves, is dyslexia a disease? Is it morbid, pathological, medically to be explained, put in a hospital and treated? That's a question we need to understand in a medical rubric. Is that how we look at it? Is it a disorder? As the DSM, ICD, we keep saying that it's a disorder if there is social, occupational, and personal impairment. The next question is, if it's not a disease, if it's not like a disorder, then is it a developmental anomaly like Epstein's anomaly or some such type of anomaly? Is it that the fellow is born with such a kind of anomaly? As for example, the terms like developmental dyslexia, dysgraphia, dyscalculia, are they differently wired from birth itself? Or is it a genetic disorder because it runs in families, we know very well, it runs in families, it is inheritable? Or some people nowadays, especially some of the social activists and all, they are asking questions, is it just a unique variation in the way people differ from each other? See, your facial features are different, my facial features are different, and the way we think, the way and kind of temperament we have. So are these the basic differences? Then finally one has to ask another question, is it a problem at all? Because dyslexia has given some rise to some geniuses, some extraordinary individuals in the area of art, science, religion, politics. These are some of the extraordinary people, Albert Einstein, unbelievable people, Leonardo da Vinci, Steven Spielberg. You have so many of these, even in India, Srinivas Ramanujan, some extraordinary geniuses we have had who are basically. Then in our country, as the chairperson was trying to say, is it about linguistics? Is this whole issue of dyslexia about linguistics? Is it that the great oral tradition in India, where all these mantras are spoken in the ear, they are not given by hand in written form? When it is passed on from one generation to another, we have our Burrakada, Harikada in Andhra Pradesh. I don't know what they call them in Tamil Nadu, but you have similar type of this one. And then the Ajanta art. Did these fellows who were basically not so much into academics withdraw and go in somewhere and use their creativity, mathematics, astronomy, all sorts of things? Then another point, if you see from history, our Sanskrit literature, there was old Sanskrit before in the Vedas. Subsequently in the Gupta period, it was made into new Sanskrit. It was all brought into one type of phonetic structure. For example, the vowels were all put together, a, e, e, and all that. Then similarly, you have, based on the tongue, how it is touching the soft palate, you have ka, kha, ga, gha. Then it comes cha, cha, ja, ja, ta, ta, da, da, ta, ta, da, da. It keeps coming forward, and ultimately you have the labials, that is the pa, pa, ba, bum. So is it another question we have to ask ourselves? Is dyslexia all phonolinguistics? Or is it neurobiological, and therefore we need to discuss in a conference like this? Can you just put on that video? And now the angst of the in this one, or there is another video? Volume please. That's a 2 minutes video we just downloaded from YouTube. Somebody is giving their angst. That person is a dyslexic person. It was all brought together by somebody. So is it the angst that the person has, the depression, the sorrow, the way in which they are discriminated? Are we getting that viewpoint or not? So just to cover that viewpoint also. Unfortunately, there's another video actually in that. You can see it from outside. You can bring it from there. Can you do that? Yeah, that one. That would be more effective. Yeah. So from the point of view of the child, actually right now I'm teaching one child how to overcome his dyslexia. I take a 1-hour class daily for him. So just at the end of my clinic, and he says that all these feelings echo with me very deeply, and he develops that kind of relationship. Now let us just keep moving into our basic subject as given in the textbooks and the journals, and try to integrate all these viewpoints. I'll integrate all of them. So the first thing is, dyslexia is a Greek origin word. We know that. As defined, it's a specific learning disability that is neurobiological in origin, and it has difficulties with accurate or disfluent word recognition, poor spelling and decoding abilities. There is a deficit in phonological component in the language. Many of these people have delayed speech, although their intelligence is quite normal or high. Sometimes, now DSM calls it learning disorders. Other people call them as learning disabilities. All of them use LD, and these are classified into 3 types: reading disorder, maths disorder, and disorders of written expression. Oops, what happened? So now some key definitions. If you just want to learn about the treatment for dyslexia, you need to know some words. What happens, these NGOs use many of these words which they pick up from us, but we don't understand what they are talking. So we talk in medical terms, so that's why it's necessary to know, as all of this is part of that concept of phonology. So phoneme is the smallest sound unit in a word, and phonemic awareness is what you have to teach. They have to be aware of small units of sound in the speech, and grapheme is the smallest writing unit, that is the letters. For example, in a word peach, the letter P is written as a grapheme, whereas the phonemes are P or P, E and Cha, like that. Coding and decoding. Coding or encoding is translating the spoken words into written, as in spelling to dictation. So somebody is speaking the words, and you have to now code it into a written form. And decoding is as in reading. You are trying to decode it, break down that word into its phonemes, and that convert that phoneme into a grapheme. Grapheme is for writing, and phoneme is for reading and unit of speech, you can say. Then phonological awareness. Very small children, the first thing is they should be phonologically aware. What is the sound that they have to, and is it meaning something, by breaking it into small pieces. So this phonological awareness includes concepts of phonemes, rhymes, onsets, syllables, subsyllables and words. What is this onset? If he now has to make a spelling of play, the moment you said play, Pa, he should know that it starts with Pa. Many of those severely dyslexic will not be able to put the P also, he will completely be blank. So whereas the milder fellow will get that onset right. After that onset, the question is how to get the remaining part of it. That is called the rhyme. That is includes the vowels as well as the remaining consonants. So how to get that second half. Many of these people will give only half the spelling, remaining he will not be able to catch. So next, phonological coding. So translating these spelling patterns into words to understand and know the meaning. And semantics is the study of meaning of words, and orthography is all about writing. So many of these people have an orthographic defect or deficit. That means they're not able to write properly, they're not able to convert that sounds into words. And phonics. Many times in schools, and you might also be parents, you have small children, some of the schools will be teaching through phonics. There are 2 methods they teach. One is called the playway method, and they'll just see it, and by seeing it visually they will see the picture and tell the picture, they will read the word which is down. So directly that is by look and say. They call it a look and say method, and the other one is, it's basically a phonic method. These Americans, they do a lot of this phonics. So from the simplest to the more complex organization of this particular coding and decoding. First, they're able to hear the oral rhymes, and then the words in the spoken sentences. Then they're able to differentiate the syllables in these spoken sentences. Finally, in the words and the onset, as well as the rhyme, as well as the individual phonemes, which is the highest way of being able to decode the whole stuff. This Jean Chal, she's a lady, she has talked about reading development. There are certain stages in acquiring reading skills. So there are stage 0 to stage 5. Usually from birth, this for normal children, from birth to 6 years. See, always in the schools they will teach nursery rhymes first, because the rhyming words, through those rhymes they'll be able to understand all about language. Speech is different from language. Language includes reading, writing, and spelling, and thinking, and so many other things. So if these words have these sounds, and that sound in the beginning as an alliteration, the beginning words will, part of the words will be corresponding to each other, whereas in rhymes usually it's the ending part of the word which is. So next, stage 1. In the stage 1, around 6 years or thereafter, what happens? Usually in the first standard they'll be after the age of 5. You can see that. So letters and these sounds are converted into words by sight or by phonics. You'll get the nature of the spellings. And in the stage 2, from second, third standard, you can find that confirmation fluency. Once they've picked up the skills of word reading, then from there on they'll try to improve the speed or the fluency of reading, and then trying to understand what they read. That is comprehension. That's from the age of 9 to 14. So that's where you have the bigger subjects, the science, the social studies, where a lot of information is given, because now you have mastered this reading skills and also comprehension skill. And then the stage 4, that is at the end of high school, to understand the concept and the facts, marshal them into facts and go into the depth of the subject. And in stage 5, many people don't even reach this, that is in the college 18 and above. I just try to put it in terms of English medium schools. What they do at the age of 3, they go to LKG, that is letter identification, reading, writing. Unfortunately, many teachers also don't know, so they keep pushing the children too much. And in the UKG, this spelling of words will be there. See, 3-letter words will be there, 4-letter words will be there. Like this, that is how the teachers understand this concept of how to teach English or a language. In first grade, the 5th standard, the age of 5, after that, that's the most important class, is the first standard. So at that time there is a word recognition, word reading. The moment they can read word by word, it's the next level of development. They can actually start reading more and more through practice. Then the next one is there is what is called chunking. When you're reading, you're putting 3 or 4 words together and chunking it and making phrases. Even when we're talking also, we're putting this concept into phrases. These phrases are what give us the meaning, and you're able to make the comprehension out of that. And in the 4th standard, you will be finding that sentence by sentence, and then the paragraphs and the composition. So now we have to ask ourselves, what is dyslexia? Is it a problem in the visual processing, the auditory processing, the phonological processing, or is it an executive dysfunction? Many of these fellows are quite lazy. They don't take out the bag properly. They'll drop the pencil. They will not even start the whole thing. Or is it working memory which is a problem? Or is it a processing speed? They're very slow in the way they're processing this information. So if you see this dyslexia, it's a bit of a busy slide, but it does try to put everything together. What do you have here? In reading, you can find that there is the person is losing the place in the text. He needs to reread it again. And there, in the motor control, handwriting difficulties are there. Memory-wise, he can't remember the dates or the phone numbers, the alphabets. And in the spatial temporal, visuospatial dimension, there's a left-right confusion. Many of these dyslexics will be wearing the chappals reverse, or they will be left-handers. There will be ambidextrous. All kinds of visuospatial problems they have. And in the writing, they have have serious issues of getting the ideas onto paper or organizing it, or it's very simple structure. They're not able to give it a complex structure like a novelist. And listening skills, they find the background and noise very distracting. So are there different types of dyslexia? Phonological, which I told you there is a phonological deficit. Surface dyslexia or visual dyslexia, where the sight words and word reading is a problem. And rapid naming deficit, they are not able to rapidly tell the names in a row or numbers in a row. And there is a double deficit of both phonological and rapid naming. Directional dyslexia of a left-right problem. Frequently they all present together. The evidence is too poor to make them into subdivisions like that. There's a lifetime prevalence of almost 10%, and you find that it's more in those people who have healthcare needs, and those, as he was trying to refer to, those with a shallow orthography like in Hindi, that is more phonetic language, the dyslexia is reported to be less, whereas if it is a deeper orthographic language like English, where the phonetic aspect is less, therefore the dyslexia is more. Obviously many of these child psychiatry problems are more in boys. That's why boys are considered naughty, not capable of studying, good for nothing, and lazy, and all sorts of things. So now dyslexia versus reading disorder. Why did I use the term dyslexia? Why did I not say understanding reading disorder? Because actually dyslexia has been used as a terminology to talk about these speech and language deficits, including reading, writing, spelling, and a right-left disorientation as a typical syndrome which you encounter in many of the child psychiatry practice. And the fundamental substrate is basically phonemic awareness, coding and decoding. Genetic factors are very high, almost 50%. The risk will be if somebody has a dyslexic in the family, and then you have some of these loci on some of the genes. Some of them are associated also with ADHD, and a neurological substrate, as he has said, the functional MRI. Functional MRI say there is an anterior part and a posterior part, and what happens is the anterior part is switched on and working, especially the speech production all on the left side, the dominant hemisphere. The inferior frontal gyrus is quite active, whereas when it comes to the parieto-temporal or the occipito-temporal, that is the visual, that part of it which is actually doing word recognition, and in the front the word analysis. There is a problem basically. This is shown here in pictures. You can see that there. I don't know which is the pointer. Yeah. So you can see the picture here where there are three areas: inferior frontal, as I said, and parieto-temporal as well as occipito-temporal, and you can see some of these PET scan studies. And the main thing here is there is a compensation. They try to use that part of the brain which is not directly meant for the speech and language functions, that is the non-dominant hemisphere, and they try to use that to compensate. They use the memory function to be able to compensate for the deficits which they have, and therefore that automaticity which is supposed to come is a major problem. What are the cognitive deficits here? As I said, phonological deficit, double deficit, and triple deficit also, where the automaticity is lost. Another theory is rapid auditory processing is a problem. Cerebellar theory is also there, and therefore again we are talking here about automaticity. And the magnocellular theory, the parvocellular pathway, the magnocellular pathway, and this magnocellular pathway which is not only for visual but it's also having connections with that. Here the main thing is spatio-temporal gating. Because the spatio-temporal gating is lost, unnecessary letters come in, or they're not able to focus on certain areas of the thing, and some are missed. It's almost like our hemi-neglect syndrome, but at a very microscopic level, where some of the letters are mixed, some of them keep jumping, they keep getting distorted. This kind of theory is there regarding the magnocellular pathway. And how does a psychiatrist diagnose it? Obviously school reports, avoidance of reading, developmental delay. Many times in speech is delayed for many of these people before they develop. and they have associated problems. The bad name for dyslexic children is basically because of the inattention which they have, the ADHD, the conduct disorder, some of those specimens of that type, not all of them go into that, but some of those people, the nocturnal enuresis, all of this adds up to the morbidity of these children. They have mathematics problems, some of them, communication disorders, these are all associated. ICD-10 diagnosis, anybody can read that book, standard tests for reading. Because ICD-10 actually, or there is a diagnosis which says on a reading test, on a standard reading test, it should show at least more than 2 standard deviations below that person for that age and for that IQ level. So therefore it's necessary to conduct some of these clinical psychologists do some of these standard reading tests. And now the question at preschool level, how do you identify it? At LKG level you can see that unable to recognize and write letters. They use their own letters, they twist them this side or that side, and they are not able to actually recognize the words that rhyme, what are called as phonic words. We have a list one, bat, hat, mat, cat, like that it goes. And primary grades, grades 1 to 3, you find that they are not able to recognize the irregularly spelled words. In English what happens is, the regularly spelled one according to how you pronounce, that's very easy, but that which you cannot, it's pronounced said. SAD it should be, or SAID it should be, he has confusion naturally. So in the same way, manipulating the phonemes and reading errors, they will be having difficulty in sequencing the letters. And in the middle grades, many of these multi-syllable words he will just, like convertible, like that. Animal, he will just twist. Some of the examples I've given. Something ending with do, tornado, volcano, and then he gets confused about the remaining part of it. So this kind of problems are there. So what to teach? Now finally, having come through all this, you are the leader of the team, you are supposed to tell your team, now you fellows, just you please start teaching these children like this. So first thing is phonemic awareness in the lower classes, and phonic word lists will be there. We have 2 word lists called word list 1 and word list 2. We keep doing that. Once they get their phonics right, then everything improves, and then you start trying to improve the speed of reading. For understanding and word meanings, you use a dictionary. You have a sight words. These small words are there, prepositions like words. The small ones like they, there, they get confused between these, or they just, for from they'll say for in they'll say on or no. Like this they keep jumping, those small sight words. Once you master those 100, 200 words of sight words, we have a list of them. If somebody wants, they can use that. And then we come to reading comprehension, and an intensive 5-day week course is what we give. 5-day week intensively we give. In the middle of the week 1 day off and Sunday off, and therefore we do 1 hour training. Once you keep doing that, then the person develops mostly on English language, and somebody has come up with a dyslexia font which prevents these tare zameen pe type of jumping of the letters and dancing of the letters. And you have educational aids. You use flashcards, word lists, graded readers, audio books, comics, computer software, apps, multimedia, DVDs, and some made easy books, some charts. And you use a 4-rule notebook, and never use the double ruled, because that's very confusing how to go up or down beyond that. Some schools use it and they mess up the dyslexics. So 4-rule notebooks, moved after that to a single ruled. Generally this without rule, it will go all over the place. So that spacing of letters and that type of concept, and tablet PC. Right now my patient, he has a nice iPad. So we're just working with his iPad also. Sometimes you'll just take the photos of the list. Sometimes you'll just use a video. You'll switch on the video and you will read it for him by putting a pointer on his book for the difficult words as you're going like that. Then he'll go on listening and seeing it any number of times. Similarly, there are some YouTube videos. And what are the strategies we used in our integrated school, which I ran for about 10 years? We used to say, we never use the word dyslexia. As somebody was saying in the forensic psychiatry part, don't use technical terms. So definitely in a school, you use technical terms, they will run away. They will say you're running a mental retardation school and not a dyslexia or a normal school. So we say it's a good school, it's a normal school. We use the term good school and weak students. So these weak students are mostly all these dyslexic fellows filtered away by the entrance examinations of the so-called good schools. They take in good students, those fellows get good ranks, and they get more students of dumb types in the lower class. They make more money, and then this is the circuit in which they go. But you are left with all the scum of humanity, as you may call it, the scrap who are not able to do it. You work with them. So we used to give reservation for 25%. We use some behavior therapy techniques. We don't have too many exams so that there's no fear of examination, and we give some extra time also sometimes. These answers are shared, and we never use criticism or negatives. No negatives, no criticism. Not only that, you try to tell them, oh, you're very good in karate, you're very good in dance, you're very good in music. So you give a positive view of himself. So that will actually have a spin-off on his deficits. And we have lab experiments, and we say go from the known to the unknown. What he knows, from there you start and go to the unknown. You teach him like that. And then we have certain types of, we used to have some additional things. So, but studies on the effectiveness of interventions, one-on-one teaching for these children. Unfortunately, the studies did not show much of an effect size, but personally when what we saw was huge, the response was so huge that people used to tell, even now many of my students who studied only first standard, second standard with us, they come back as an engineer and they tell me, oh wow, what a school, it was the best school ever, and things like that, because that is the place which they got. So these disorders of written expression are basically of transcription and composition, pre-writing, writing, post-writing, and there are writing impairments. This is an example of that kind of writing sample. You can see a very severe dyslexic on the left side, and on the right side a mild dyslexic where 7 ants, the spelling of 7 is gone. There you can see some of the type of problems. If you give me just 2 minutes, sir, I'll close. Flowers, spelling is wrong. Here, the capital letter did not start the sentence. These people have problems with punctuation. They have problems. You can see here also the F is rather small. It's not gone up big, and things like that. This kind of problems are there. You'll identify them and you just iron them out. And these are some of the signs of severe problems in written expression, some of the frequent spelling problems which they have, and the problems in dysgraphia are not merely only in writing areas, they are also in other functions. Certain standardized tests for writing and remedial writing sessions, these are very important. You teach them to put a finger for spacing between words. You show them how to space the letters, letter formation, how it is, capital letters, punctuation. You keep on drilling this. Basically, you keep on drilling certain types of habits, the study habit, the work habit, the quality habit. You bring all this into their play. Then the organization of their books, organization of their life, organization and planning about time. This time concept is very poor. There is dyscalculia, which is another mathematics difficulty. Many people who have difficulty with maths generally become doctors at the end of it. But there is a core, pure maths problem for about 2% of the children, whereas another 4% approximately will have both dyslexia as well as a mathematics problem. But you should not look at it only as a deficit. You look at it as unique strengths of the dyslexics. As I was trying to tell, some truly great people had dyslexia. Maybe it is the dyslexia which made them great. This is a thing which some of these people used to say that. In fact, the school dropouts are the fellows who have made all our stuff, including our iPhones, Steve Jobs. So these fellows are basically who dropped out of school were able to do better than those who went through school like us and just became a professor in a medical college, too good at academics, a state ranker in intermediate, ended up in medicine, and therefore, entrepreneurship. One thing which these fellows can do very well is they can manage people, entrepreneurship, they can see the big picture, they have insightful thinking, creative thinking, mechanical skills, animation, graphics, maybe even Bahubali is being done by some of the dyslexics only. That's why it's such a huge hit. We don't know. So we always tell them every person is unique in this world. We used to tell them born to rule and born to win. That's the starting of our school. This one, you are born to rule and you are born to win, not born to fail. So that is the thing. Avoid medicalizing the problem. Try to use methodology and technology. Teaching methodology, technology, and acceptance. Once you have done that, you can hear what good old Einstein had to say. Everybody is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid. So you're trying to make the dyslexic fellow who's strong on right side of the brain, trying to do things with his left side of the brain which is somewhat deficit. Whether he should leave the left side alone, left should be left and the right should be made right, is the question you have to ask. So think in the present as the right brain thinks, rather than the past and the future as the left side thinks. Just to put it, thank you very much for giving me this opportunity, sir. Thank you very much. I hope I have justified your faith in the newer generation.
Thank you, Dr. Radhakanth. That was an excellent presentation. You delineated the clinical features of dyslexia. And the most touching thing was how a dyslexic child would feel that realization and the kind of experiences, which is of course is indeed saddening, is going through, giving clear understanding. And finally you narrated the strategies that we could employ to help these unfortunate children. And I'm happy that you concluded with a happy note, with an optimistic note. Thank you very much. It was a brilliant presentation. I'm sure, though it was very explicit, candid, to the point, certainly there could be few questions that would have come up. How many questions could we allow? 2, 1. Let's see who has the first chance. Yes, please.
Thank you, sir. I'm Dr. Lakshman, coming from Vellore Medical College. I just want to know a few things. Like it was a very lucid presentation as such, and you had to rush around as you wanted to really explain a few things which is not because of the lack of time. My point is is this dyslexia is language oriented, because we read in terms of signs and sounds, and that is how we understand language, and based on that, so because most of the people who we are not English speaking population as such, and how do we differ thus, and do we have any yardsticks in other languages, and how do we find it out as such? And that's my first question. And second question is, a lot of ignorance in school teachers and academicians about the dyslexia, and how do you go about that? And that's my second thing.
Very good questions, both of them very valid also. The first question is, do we go and teach them only in English medium, Or what about the vernacular medium? Do you have any evidence? Do you have any material which actually helps the person in, say, in Tamil or Telugu? Since I'm from Andhra, many of these children who perform poorly in English medium schools, expensive English medium private, they shift them to public schools which are Telugu medium, and they perform much worse. They try to put them in missionary schools which are Telugu medium, but they perform much less because the Telugu language, the way they have to write, it's a very complicated structure. So they have a lot of difficulty with that. And the number of, letters are much more in regional languages than in English. In English, there are only just 26, whereas in Telugu, there are a lot more than 50 plus. So that is one of the things. Second thing, what we find is the best teachers go to English medium schools. They're trained in B.Ed. They're trained, to have an aspirational orientation to life, and they're made to feel good, and they're given a lot of importance. So some of these additional factors, we find that actually in English it works very well. Usually I tell my patients, do not shift to Telugu medium, stay in English medium, reduce the number of languages. See, they have 3 language formula: English, Hindi, Telugu, first language, second language, third language, too many languages. In our school, what we did was, we removed one language. We used to have no language except English for LKG, UKG. From first standard onwards, only one language, either Hindi or Telugu. That will go up to 5th or 6th, and after that only you have the third language. We used to space this because language is something that like a diabetic unable to take sugar, too much of language is detrimental to the dyslexic fellow. So we tried to slow down on that. The next thing we used to do was, we used to have more English medium books or more English books. The English subject was given 2 periods compared to other subjects which were given 1 period each. So 2 periods in which reading was very important. The teacher had to read, everybody had to read, everybody had to underline, and everybody. So we gave a lot of importance for English. So in that manner we try to lopside the whole way in which we are teaching by management systems, school management techniques, where you try to give more importance to the areas which they have deficits. Luckily, even the normal children in those schools were coming from low socio-economic status because it was a non-profit. So therefore, they were all very good with this because they could speak good English, they could think in English. So that language skills were very important. And your second question was on?
It was on about the academicians and school teachers who are not aware of
school teachers. So what we used to do, we never used to take experienced Kerala teachers, as they call it in our areas. We never used to take them. We don't want too much experience because that experience is bad for the child. They will force them to do in a particular way. We used to take fresh graduates from missionary colleges who are brilliant, smart, good looking, just waiting to get married in 3-4 years. We used to like that because they used to have that innovative approach, and we could pay them less also. But they used to work very well. And what we used to do, they used to follow my teaching. Every Saturdays we used to take up for them, it was a half day, I used to take up 1 hour class for the teachers on how to teach English. For example, how the textbook is written, how the author has written it. Is it a communicative method, or is it a grammar translation method he is using? Is it a structural method that he is using? This kind of approach, how the book is written and how you are supposed to deliver the instruction. So how the instruction is delivered is very important compared to just what instruction is delivered. So in our schools, we don't give importance to how the instruction is delivered. We don't monitor the quality, whether it's a medical college or a junior college or an LKG class. So that quality of instruction. So we trained our own teachers. We did have a few B.Ed qualified who are also inclined in this manner. And teachers' resistance, I did speak in a few schools and all, the resistance is generally nearly zero, because they're very happy to find somebody who is able to commiserate with their misery, saying that all students have to get 100% first classes. 100% distinctions. The only way they can get is by getting rid of the fellows who are not able to perform. So that is not the way. They could understand that, and if they had any trouble with these children, they could push them off to us. So they were happy to offload some of these fellows to us. So there is no resistance in that sense. But what we used to tell them is, these weak students, as we call them, or dyslexics, bring them to the front bench. So you can monitor them, you can make sure, you can give extra time for writing, you can make sure that their classwork is done properly. Because of monitoring, they give a better performance. So we put them in the front bench. So this kind of techniques, classroom management techniques, if you teach, teachers will be quite happy to accommodate some of these ideas. And many of these fellows are quite brilliant. My first student of that school had a 99 percentile on Raven's colored progressive matrices. He could not even write the letters, small letters, properly. He was supposed to be in the 5th standard. We put him in the 3rd standard. I sent him to Nimhans and they said he is useless. He will not be able to do. Try to just help him. Nimhans is the child psychiatry department. Truly a great department, I can say, in Nimhans, especially Dr. Satish Girmaji, Shobha Srinath. They've done some great job. When I was an MD, I went there. They taught me the importance of child psychiatry, and that's what inspired me to do some of this work, and I can actually dedicate my lecture to them also. So it is possible. Next question.
Yes, sir.
Good evening, sir.
Yes.
Thank you so much. We learnt a lot today. I am Rajalakshmi from Tiruchirappalli. Actually, I have a child who is doing her academic at Kendriya Vidyalaya. She found initially the reading is difficult. Then after continuous training, she was able to pick up. But as you said that 6% mathematics disorder. But I'm just able to see her intellectual skills high in mathematics than in reading. But writing, she is okay. So so now I have to focus more on reading.
Okay, that's a good dilemma.
Second question, and you said no, the genetic maybe so I need a little more clarity in that.
Yeah. So usually it runs in families. If somebody, you can find in the families some left-handed people. In the families, you can find some people who are having dyslexia and therefore they moved on to business instead. And they were, learning disability. They were not, see, the word learning disability includes autism in some countries. It does not include autism and is only for dyslexia in some countries. Better to use it only for dyslexia rather than for autism, because there's a total confusion between the two. So in this child's case, for example, in the early stages, you should focus on the reading, writing, spelling and all. After that, you should focus on the strengths, because otherwise much of the time is wasted while all the other fellows are going quite ahead. So you can put her in STEM subjects. In fact, many of these children, they do very well in mathematics, and many of my students are engineers, doctors, and some fellows have also gone to film industry, animation graphics and similar such kind of things. So you can always address the strengths. See, when the whole of modern life is about looking at the strength of the individual or the system and learning from it and conditioning it in such a way that it performs much better, that overcomes the weaknesses which are there. But if there is a lot of subject reading to do, like in law or in biology, it becomes too much. So you are overloading a deficit system. Better to focus on mathematics. In fact, many of these students are very good at mathematics. I was referring to specifically that mathematics disorder or specific developmental delay in mathematics. In that is having an average of 6% prevalence, of which 2% is a pure maths disorder and 4% includes ADHD, those with concomitant ADHD or dyslexia. So that's how I was trying to tell you. There are a lot of questions.
Thank you, Dr. Radhakanth. I'm afraid we have to close the session because of paucity of time. I appreciate your concern, but then You can certainly speak to, make use of the presence of Dr. Radhakanth. You are going to be here tomorrow. Wonderful. Please, because of the time constraint, things should move on. Thank you for the enthusiasm. I'm sorry. Right. Thank you. Thank you for the patient listening. Thank you for the wonderful response. And Dr. Radhakanth, you did a wonderful job. Thank you very much.
Thank you, sir.